the Chief Health Officer has advised that vaccination will be a requirement of work. This is a CHO direction under the Public Health and Wellbeing Act. It will be a requirement of work for all staff at all schools, again, government, Catholic and independent, and all early childhood education and care settings. So vaccination will be a requirement of work via a CHO direction under the Public Health and Wellbeing Act. We all know that vaccination is our pathway through this pandemic. The requirement will be first dose by the 18th of October and a second dose fully vaccinated by the 29th of November. This protects staff, it protects students, it protects our children's families. When you think about the reasons why the CHO has made this recommendation and issued this direction, we only recently expanded vaccination for children 12 to 15. Children under 12 do not have access to a vaccine. So we've got to protect our kids, both from contracting the virus and also transmitting the virus when they go home to their families. So the best way to do that is to ensure that people who work with our children in early childhood and care settings in our schools, that they are all required to be vaccinated. So this is a significant announcement that we're making today. On Sunday, we announced as part of the roadmap back to school, and we're doing that as quickly as we can. And I'm just so excited to get students back face-to-face in front of their teachers. And today we're announcing a range of mitigation measures to make sure that when schools open, they stay open. I'll now hand over to the Deputy Chief Health Officer for some further updates, and then we're happy to answer questions. Thanks, Deb.
Thank you, Deputy Premier. In terms of the spread of infection, of today's cases, more than 57% were in the northern suburbs of metropolitan Melbourne. The local government areas included 194 cases in Hume, 80 cases in Whittlesea, 47 cases in Moreland, 23 cases in Darebin, 10 cases in Banyule and 8 cases in Yarra. In the western suburbs of Melbourne, there were cases including 27 in Melton, 52 in Wyndham and 34 in Brimbank. And in the southeast, we've seen cases including 26 cases in Casey, 14 in Cardinia, 7 in Stonington, 8 in Port Phillip and 7 in Kingston. In terms of regional Victoria, there were 11 cases in regional Victoria reported yesterday. There was 1 case in Wangaratta, and this is believed to have been acquired in Melbourne. In East Gippsland, there was 1 case. However, this is the residential address of this case, but they are in New South Wales and acquired their infection in New South Wales. There were 2 new cases in Geelong, 1 believed to have been acquired in Melbourne, and the other case is being reviewed by an expert panel today to reassess whether or not it actually is a true positive result. There were 4 cases in Mitchellshire. 2 of these are household contacts of known cases, and the other 2 cases are still under investigation.